Hi friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. So we're just trying to do what's best for us and our families. We listen to the recommendations. Take calcium, get a mammogram, get a colonoscopy. We listen and we try to follow because we need information. We're trying to do the best we can. We have to trust our sources, like the CDC, Centers for Disease Control. We have to trust them, because those are the people that are, helping fight Ebola and things like that, really scary stuff. And we need to trust them. We want to trust them. Where else are we going to get our information from? So a report was published just recently. It was published in a medical journal by a medical researcher who stated that when he was working for the CDC to determine if the chicken pox vaccine was a good thing back in 2002, he found in his report that there's things that were not good about the chicken pox vaccine. The CDC dampened the research. It modified it to make it appear that what he reported was not what was happening, that it was all okay. This man lost his job over it. He resigned, and that was in 2002. And now in 2018, he finally is able to publish his report. And I'm going to read a little bit of that. And, we have to really start to question. We have to really start asking the questions like, what's really best? And who's taking care of us? And we all need to ask, not just me. I tend to be a little bit neurotic about this stuff, but we all need to ask. Dr. Goldman said in his resignation letter back in 2002, when research data concerning a vaccine used in human populations is being suppressed or misrepresented, this is very disturbing and goes against all scientific norms and compromises professional ethics. That was in 2002. He found that when a child is given the vaccine for chicken pox, it stops them from getting the chicken pox. He knew at that time that shingles would become more prevalent in the adult population, and this is why. Adults get almost a booster shot from coming in contact with children that are just about to get the chicken pox, that have the chicken pox, that recently had it. We get this mini booster from just coming in contact with them in society. And that's why shingles was very rare when I was in chiropractic school back in the late 80s and early 90s. Now it's very common. What Dr. Goldman stated in his 2018 article was that the CDC officials manipulated the data to support the chickenpox mandates. So I'm just asking you to be careful out there. Ask the why. What's so wrong with chickenpox? We all have to take care of ourselves because there's other things at play that are beyond what's best for us. So putting the power and knowledge of your health back in your hands. Bye for now.